Okay, what would justify an orthodontic emergency? Well, I would say that anything that's causing pain or discomfort, in my mind, I want you to call me. Or the way we operate is we have, we call it the on-call phone. So someone, when they leave this office every day, has this telephone, and we give you guys, we give the patients the number. If there is an emergency or you have a concern, you call us, text us, send us a photo. You know, we have a lot of cool ways to, I guess, assess, and I'm not going to use the word triage. It's generally not that bad, but you know, I've had some fairly significant injuries to teeth, but generally speaking, we use that to answer questions after hours and to give you proper guidance if you do have a problem. I would say an orthodontic emergency is kind of rare. It can happen, but it's not a common occurrence. So that's sort of the way we ensure that if there is an issue, we can assess whether or not it's a true problem or how it should be addressed and when it should be addressed. You know, the question was, if I feel like I'm having an orthodontic emergency, how do I get in touch with you? So we have a telephone that one of our staff members has at all times. We call it the on-call phone. And after hours, you can call that number if you have something going on that you feel like is an emergency. If you think it might be an emergency, please call. What we will be able to do is often share a photograph or get a better description. You can answer some questions we may have, and we'll be able to walk you through how to address that yourself, or you know, maybe that what you think is an emergency is actually potentially a normal you know, part of the process. I'd say that's kind of rare, but you know, sometimes there are concerns that you just didn't think to, you know, ask a question about during the visit. We are accessible.